Hi, my name is Scott Reid. I'm an adult reconstruction surgeon here at Tulsa Bone and Joint. One of the things that I offer my patients when it comes to hip and knee reconstruction is technology, use of technology in order to be able to plan their surgeries. So one of the things that I offer my patients when it comes to hip and knee replacement is not just standard planning, but 3D pre-planning, things that make it possible for us to determine whether a patient's going to have any complications or challenges that we might face during the surgery. One of those technologies called Hip Xpert. So what Hip Xpert does is we take a CT scan of the patient's pelvis before the surgery. We then create a 3D model off of that CT scan, and then it allows us to position the components in that 3D model just like we would do in the operating room, except we're not having to do that in a trial and error while the patient's asleep, while we have a wound open. We can do all the trial and error and planning, you might say, before we get there. And so the benefits to the patient when we do that is we can generally make a much smaller incision. We don't have to dislocate the hip when we do it that way. We keep all the muscle attached to the proximal part of the femur, which in turn gives the patients less pain after surgery. It allows them to recover from the surgery much quicker. They have less limp, and most patients are pleased that they don't have as big of an incision. From my perspective, and what I really want to impress upon the patients, that when we get that component positioning just right for you, it's much more likely to last you longer, and you're extremely less likely to have a dislocation after surgery, which is a major concern when people are looking at hip replacement. So that Hip Xpert, it is an extra that patients can choose to use in our service, but the patients that do choose to use it have been very satisfied. If you're interested in learning more about Hip Xpert, we'd be glad to talk to you about it in the clinic. You can also reference some of the videos that we have on my webpage.